Okay, so now we're going to start our series of lectures on the topic of anatomy of the abdomen. Now, before we go into discussion of the detailed anatomy, there is a few introductory points or a few concepts that you need to know beforehand so that your understanding of the abdomen will be easier. Okay, so the first is, what is the abdomen? So it is basically the region between your trunk and your lower limbs. Okay, that is underneath your ribs and then above the pelvis. So that is the abdomen. Now the abdomen can be divided into the abdominal cavity and the pelvic cavity. Okay, and if you want to go one step further, the abdominal cavity is further divided into an anterior and posterior part, and the pelvic cavity is divided into it is different in males and in females. Now I've included the diagrams. In the first one here, you see this is the anterior view. This is, the anterior part, and this is the posterior part. So in the anterior part, you see the liver, the stomach, the loops of intestine, and all that. And in the posterior, you essentially see the kidneys, the pancreas, and the vessels and spleen. So that is the abdominal cavity. And the pelvic cavity is different in the males and the females. So the basics are the urinary bladder, which is common in both. Then in the males we have the urethra, the male urethra, the testes, the prostate, and in females we have the vagina and the uterus. Okay, so from your exam point of view, questions will be asked from both the abdominal cavity and the pelvic cavity. Okay, now I'll be beginning with the discussion on the abdominal cavity. And after discussing the entire abdominal cavity, we'll move on to the pelvic cavity. Now, before we go into the discussion of the abdominal cavity, there is a few things you need to keep in mind. And the first is the regions of the abdomen. So the abdomen can be divided into 9 regions by 4 lines, and these are two transverse lines, and 2 vertical lines that pass through the mid clavicular lines. So the right and left mid clavicular lines. And because of this, we have 9 regions, and the first is the umbilical region. So this here is the umbilical region. Now above and below the umbilical region, we have the epigastric region and the hypogastric region. Okay, and then underneath the ribs we have the hypochondriac region. Hypo meaning below and chondriac referring to the ribs. So we have the hypo right and left hypochondriac regions. And then we have the lumbar region, the right and left lumbar region, which is lying on either side of the umbilical region. And finally we have the iliac fossa. Okay, so these are the regions of the abdomen. Now the importance is, you need to have an idea of where each organ is placed. So for example, a specific organ occupies which all regions of the abdomen. So this helps you in your, when you go into your clinics, and you'll be, for people who want to do surgery, you need to have an idea of the regions of abdomen. Okay, now moving on, we'll talk about, in brief, about the development of gut. Now the development of gut. So we have a gut tube. Okay, the developing embryo has a gut tube, and the gut tube divides or differentiates into 3 different tubes. It's basically the same, but it has 3 functional parts, and these are the foregut, midgut, and the hindgut. And from the foregut arises a number of organs. From the midgut, a number of organs, and the hindgut, another number of organs. Okay, now the feature of the development is, we have the aorta that lies posterior to the gut tube. So imagine the abdominal aorta being like this. Now the arterial supply of the foregut, midgut, and hindgut will be common. that is for the foregut, or for the organs that develop from the foregut, they have a common artery supply, and for the midgut another common, and similarly for the hindgut. Now, what are the arterial supply, or what are the base the important trunk or important branch of the abdominal aorta from that supplies the foregut, midgut, and hindgut? Okay, so the arterial supply, okay, so for the foregut we have what is called as the celiac artery. So the celiac branch of the abdominal aorta supplies the foregut, and next we have supply the midgut. We have the superior mesenteric artery, and that supplying the hindgut is the inferior mesenteric artery. Okay, now having talked about the arterial supply of each of the derivatives of the gut tube, we'll look into the structures that develop from each gut, from each derivative. So the foregut, I have included this table here. So we see, before I explain what is going on, let me give you an idea on how you can remember this. So just note in your, just imagine a food being the path followed by an ingested food. So basically we have the esophagus. The esophagus enters the stomach becomes the small intestine, and the parts of the small intestine are the duodenum, and then we have the loops of jejunum, ileum, and the ileum opens into the cecum, and the cecum, if you remember or if you know, it has the vermiform appendix. And then we have the ascending colon, then the transverse colon, descending colon, then the descending colon becomes the sigmoid colon, and finally opens into the rectum, which ends at the anus. Okay, so imagine this path as a singular tube, and we're going to mark two junctions, and the first junction will be at the upper half of the duodenum, and the second junction will be the right or proximal 2/3 of the transverse colon. Okay, so if I were to put these junctions in our previous diagram, this here is the duodenum, and the upper half of the duodenum is this, and then we have the transverse colon, and the right 2/3 is basically this. Okay, now the structure starting from the esophagus till the upper half of duodenum is basically the foregut, and then between the upper half of duodenum, that is from the starting with the lower half of duodenum to the right 2/3 of the transverse colon, are the derivatives of the midgut, and the rest from the distal or the left 1/3 of transverse colon to your anal canal constitute the hindgut. Okay, so this is basically an idea on how you can remember the derivatives of the guts. And remember, the foregut is supplied by the celiac artery, which is a branch. All of these are branches of aorta. So the first is the celiac artery, and the midgut is supplied by the superior mesenteric artery, and the hindgut is supplied by the inferior mesenteric artery. Moving on, we'll be discussing about the peritoneum. Okay, so the peritoneum is basically, you can imagine, okay, I'll first discuss the definition. So the peritoneum is a large thin serous membrane lining the interior of the abdominal cavity. Okay, so if you want to have an idea of how the peritoneum is formed, So just imagine the peritoneum as a balloon, okay, a balloon, and you're gonna insert your fist into the balloon without popping it, okay, and your fist is the organ and the balloon is the peritoneum. So from this you can understand that basically the organ is not within the peritoneum but is just surrounded by the peritoneum, okay. So to have a better idea, I'll just talk about the, for example, if this is the gut tube, okay, and we have the aorta supplying, what are the three branches? The celiac artery, superior mesenteric artery, and the inferior mesenteric artery, okay. Now the peritoneum, as the embryo develops, the peritoneum is basically a structure like this, okay. And what happens is the gut tube gets pushed into the peritoneum, but it retains its arterial supply or the vascular supply. So if I were to take a transverse section, we'll have, if this is the gut tube and this is the aorta, initially we have this is the peritoneum, the peritoneum in blue, and later on what happens is as the organ gets pushed into the peritoneum, it becomes like this, and finally at the end of development you end up with, we have the gut tube here, this is the structure formed. So we see that the organ is entirely pushed and it is covered by the peritoneum except at the place where where the blood vessels come to supply the organ, okay. So from this we can see that the peritoneum has two layers, and this is the visceral layer, that is the layer of peritoneum attached or in close relationship to the viscera referring to the organs. So the visceral peritoneum and the layer of peritoneum that is attached to the body wall, that is called the parietal peritoneum, okay. And you see the peritoneum folds on itself to form this double layered membrane, and the function of this double layer membrane is to provide a passageway for the vessels supplying an organ, and this double layer membrane is called the mesentery, okay. So this is the basics of the peritoneum. So I'll just read through the notes. So we have the peritoneum is a large thin serous membrane lining the interior of the abdominal pelvic cavity. It has two layers as we've discussed, the parietal and the visceral peritoneum. And the next point that I will mention is between the two layers a potential space is present, that is this space, and this cavity is filled with a fluid that lubricates the two layers and facilitates the movement of organs ensheathed by the visceral layer. Now this pelvic the peritoneal cavity is filled with a fluid, and the function of the fluid is to help in the lubrication. Now usually the volume of fluid within the peritoneal cavity is less, that is it is usually around 50 ml, but in some diseases or in some pathological cases there is excessive accumulation of fluid in the peritoneal cavity, and you can include that as an applied anatomy, that is the excessive accumulation of fluid within the peritoneal cavity is called as ascites, and it may be asked in your vivas, what is ascites? So it is the excessive accumulation of fluid within the peritoneal cavity, and if you want to have a clinical picture of how that looks, it's basically this, okay. So we've discussed the basics of peritoneum, and we've talked about the applied anatomy, that is ascites. Now moving on, this diagram here. So this is basic. Uh, this is a diagram given in your textbook that is trying to depict this image. Okay. Now the next point I've mentioned is the mobile parts of the intra-abdominal digestive tube are completely surrounded by the visceral layer of peritoneum, except for a small area where it passes from the tube to the post-abdominal wall as a double layered fold. So basically they're talking about the mesentery. So it passes from the gut tube to the posterior abdominal wall where the aorta is present, and that is called the mesentery. Okay. Now for completion's sake, I have included the differences between the parietal and visceral peritoneum. You can just have a read through that. Now the next thing we're going to discuss is the concept of intraperitoneal organs and retroperitoneal organs. Okay. Now essentially what happens is, what we've discussed so far is a typical intraperitoneal organ. Okay, that is, it is surrounded completely by the peritoneum and is suspended by the mesentery. So an intraperitoneal organ is basically organs suspended by the peritoneum, and because it is suspended or it is intraperitoneal, it is mobile. Now retroperitoneal organs are organs lying outside the peritoneal cavity. Because they are lying outside the peritoneal cavity, they are fixed and immobile. Okay. So if I were to take this diagram here, you see the kidneys. This is the peritoneal, this is the peritoneum, the one that I've just colored. You see this here is the kidney, and the kidney is not embedded within the peritoneum, or is not inserted into the peritoneum, and hence kidney is an example of a retroperitoneal organ. Coming back, the retroperitoneal organs can be of two types: the primary retroperitoneal organ and the secondary retroperitoneal organ. So primary retroperitoneal organ is as it develops retroperitoneally, that is, it is never within the peritoneum. Secondary retroperitoneal organ, on the other hand, are the organs that are initially suspended by peritoneal folds but later lose their mesentery and become retroperitoneal. And the process of losing the mesentery is by zygosis. Okay. So if you want to have an idea, look at this diagram here. We have the gut tube and this is the mesentery. What happens is the mesentery is fused into the layers of peritoneum. That is, one layer of mesentery becomes part of the visceral peritoneum, as you can see here, and the other becomes part of the parietal peritoneum, and in the end you see this organ becomes retroperitonealized. Okay. So we've discussed primary retroperitoneal organ and secondary retroperitoneal organ. And remember, secondary retroperitoneal organ is initially intraperitoneal, but because of the process of zygosis becomes secondary retroperitoneal. And for your exams, zygosis may be asked as a 1-mark question, as in secondary retroperitoneal organs are formed by the process of dash zygosis, or the process of absorption of mesentery is known as dash zygosis. Okay. Now next we'll talk about what all organs are intra-abdominal and what all organs are intraperitoneal, and what all organs are retroperitoneal. Now for that, just remember the retroperitoneal organs and the other organs are all intraperitoneal. So the retroperitoneal organs, we have a mnemonic, and that is SAD pucker. Okay, SAD pucker. Now the S stands for the suprarenal or the adrenal glands, A for the aorta and the inferior vena cava, D for the duodenum. I've included that it is the second and third parts. Okay, when we're going into the detail of duodenum, we see that there is 4 parts, and the second and third part are retroperitoneal. Okay, moving on, we have pucker standing for P for pancreas, U for the ureters, C for the ascending and descending colon, K for the kidney, E for the esophagus, and R for the rectum. Now, here I've also mentioned the primary and secondary retroperitoneal organs. Now, the primary retroperitoneal organs, you can remember, is basically the structures related to the kidney. So we have the kidney, and above the kidney we have the suprarenal glands, and arising from the kidney we have the ureters. Now, these are primarily retroperitoneal, and the rest are secondary retroperitoneal. Okay, so this ends our discussion on the intraperitoneal and retroperitoneal organs. Moving on, let's discuss about the peritoneal folds. Okay, now the peritoneal folds are formed by the viscera peritoneum, and their function is to provide mobility to an organ and to provide a passageway for nerves and vessels. Okay, so we've actually discussed one of the types of peritoneal folds, and that is the mesentery. Okay, basically there are three types of peritoneal folds, and these are the mesentery, the omenta, and the ligament. And the omenta is basically the folds of peritoneum that connects the stomach to the viscera and other organs, and ligaments are basically the folds of peritoneum connecting two different organs. Okay, now to have a better understanding of the peritoneal folds, we have to go a bit into the embryology, as in how the gut develops. So in this diagram, this is actually an we're looking at the embryo from a lateral aspect. Okay, so we have this is the dorsum, and this is the ventral area, this is the superior, and this is the inferior, or the cranial and caudal. Cranial referring to the head, and caudal referring to the legs. That's a basic. Okay, now the foregut and the midgut and hindgut. Okay, the foregut has two types of mesenteries. It has a dorsal and ventral mesentery. The structures in this diagram in green are the mesenteries. Basically, we have a ventral mesentery we have a dorsal mesentery and a ventral mesentery. Okay, now the foregut has two mesenteries, a dorsal mesentery and a ventral mesentery. Now the major structure that develops from the foregut is the stomach, and hence we named the mesenteries as the ventral mesogastrium and the dorsal mesogastrium. Okay, now the liver and spleen have their own embryological developmental sources, and what happens is, because of the liver, or because of the developing liver, the ventral mesogastrium is again divided into a ventral and a dorsal part, and the dorsal mesogastrium is divided into a cranial and caudal part. Okay, so I've included that the foregut has two mesenteries, the ventral mesogastrium and the dorsal mesogastrium. The ventral mesogastrium has a ventral and dorsal part because of the developing liver, and the dorsal mesogastrium is divided into a cranial and caudal part. Now, if you see from the diagram, the cranial part is again divided into a ventral and dorsal because of the developing spleen. Okay, now what happens is, this here gets converted into the diagram below. Okay, so next we're going to talk about the derivatives of the ventral mesogastrium and the dorsal mesogastrium. Now this is the posterior abdominal wall, and this here is the anterior abdominal wall. Okay, now the ventral mesogastrium, its ventral part develops into the falciform ligament and the coronary ligament. Okay, the ventral part of the ventral mesogastrium gets converted into the falciform ligament and the coronary ligament, and what it is basically, it is a fold of peritoneum attaching the liver to the anterior abdominal wall. Okay, this here, so that is the falciform ligament and the coronary ligaments. Now the dorsal mesogastrium, the dorsal part of the ventral mesogastrium gets converted into what is known as the lesser omentum. And if you remember, the omentum is basically the folds of peritoneum connecting stomach to the viscera or to another organ. Okay, so here you can see the dorsal part of the ventral mesogastrium gets converted into the lesser omentum. Okay, now talking about the dorsal mesogastrium, we discussed that it has a caudal and cranial part. Now the cranial part, in simple words, it gets converted into a number of ligaments that that connect the different organs. So we have the gastrophrenic ligament, the gastrosplenic ligament, and the lienorenal ligament. Now the gastrophrenic connects the stomach and the diaphragm, the gastrosplenic connects the stomach and the spleen, and lienorenal connects the spleen and the kidneys. So the cranial part of the dorsal mesogastrium gets converted into the various ligaments. Now the important point you need to know is that the caudal part, that is this here, it gets converted into what is known as the greater omentum. Okay, remember, omentum connects the stomach to the viscera as well as the organ. Okay, and the ligament connects the different organs, so that is the difference. So we've discussed that there are two omenta, the lesser omenta and the greater omenta. The lesser omenta arises from the dorsal part of the ventral mesogastrium, and the greater omenta arises from the caudal part of the dorsal mesogastrium. Now I've highlighted these because they may be asked as one mark question, and these are usually asked in your anatomy practicals. Okay, now moving on and talking about the midgut and the foregut. Now the midgut and foregut only has a dorsal mesentery, and the names are simple. So if it is attached to the intestine, it is called mesentery, and as the mesentery of the appendix, vermiform appendix, is called the mesoappendix, and the mesentery of the transverse colon is called transverse mesocolon, and that of the sigmoid colon is called the sigmoid mesocolon. So the names are simple. It's named according to the organ that it suspends. Now this, I've included one more diagram, and this is to have a better idea of the development of the mesenteries of the foregut. Okay, so the structure in yellow is the peritoneal cavity, and this here is the dorsal mesogastrium, and this here is the dorsal part of the ventral and ventral part of the ventral mesogastrium. Okay, and as you can see, during the course of development, it becomes the dorsal part becomes the lesser omentum, and the caudal part becomes, okay, this is the cranial view, so the greater omentum is not mentioned, but the cranial part becomes as I've told, into a number of ligaments, and we see the ligament connecting the stomach and the spleen is the gastrosplenic ligament. Now connecting the liver and the abdominal wall, we have the falciform ligament. Okay, so I hope you've got an understanding of the peritoneal folds. Now if you cannot visualize what is going on, I suggest you go through videos of this guy named Sam Webster on YouTube, and he explains because he has a lot of anatomy models. He has a lot of models. He, with the help of a plastic wrap, he explains how the mesogastrium and the mesenteries are formed. So if you want to have a better understanding of what is going on here, you can refer to those videos. So refer Sam Webster's YouTube channel. Okay, now from your exam point of view, as I've mentioned, the greater omentum, lesser omentum are their development sources may be asked. Now one more thing that I forgot to mention is Because of the development of these ligaments and folds, we see that the peritoneal cavity is divided into two, and we have the lesser sac and the greater sac. Okay, so do not confuse the sac with the omentum. Okay, so lesser sac and greater, the sacs are basically formed by the splitting of the peritoneal cavity. Now if you want to have a better understanding, look, you can come to this diagram here. The one in blue is the lesser sac, and the one in yellow is the greater sac. Now for the exams, commonly asked question is about the epiploic foramen. Now the epiploic foramen, or foramen of Winslow, is basically a connection between, or a communication between, the greater sac and the lesser sac. So that is the epiploic foramen. Now an applied anatomy related to it is the internal hernia, where we've discussed the femoral hernia. So in a similar manner, the loops of small intestine may herniate through the foramen of Winslow into the lesser sac. Remember, the intestine is actually a part of the greater sac, and the loops of small intestine, because it is a slit, it may, when there is increased intra-abdominal pressure, it may herniate into the lesser sac through foramen of Winslow, and that leads to what is known as the internal hernia. Okay, and with this we conclude the part 1 introduction of the abdomen. And before we move on to the second part of the introduction, you can have a read through of the topics that we've discussed so far.